As parents meet with specialists and professionals before, during, and after their child's pediatric audiological evaluation, they will undoubtedly receive a great deal of information. To help keep track of this information, it is important for both parents and professionals to receive a complete report of evaluation results. By consistently collecting and organizing information, parents will be able to provide professionals with information needed about their child. Likewise, it is imperative that audiologists spend time during the appointment to explain to parents, using understandable terms, the results obtained during the evaluation. This important step will enable parents to understand the results of their child's evaluation, the recommendations, and the agreed-upon next steps. In addition, the audiologist should also provide his or her contact information to the parents so the family has a resource available to them should questions, comments, or concerns arise in the hours, days, or weeks following the appointment. Therefore, an accurate and age-appropriate evaluation must always result in a clearly written and understandable report that can be shared with parents, early interventionists, medical providers, and other professionals involved with the child and family. A useful written report will contain 8 key points, including basic patient demographic information, such as patient's name, date of birth, gender, contact details, physician information, referral reason, and the evaluation date. Number 2, pertinent information obtained during a case history. This information typically includes whether or not there is a history of hearing loss in the family, pertinent birth information, and any hearing screening results. Number 3, a list of the tests completed during the evaluation. Number 4, a list of tests that were not completed and the reason why. Number 5, ear-specific results for each test administered. For example, what the child can hear in the right ear and what the child can hear in the left ear. Number 6, an explanation of the child's activity level or wakefulness during the evaluation will also be included in a useful report. Was the child cooperative, relaxed, asleep, awake, or sick at the time of the evaluation appointment? Number 7, a summary section should clearly state the results of a complete diagnostic evaluation. Then lastly, number 8, the recommendation section should clearly describe the necessary next steps. It should include referrals to professionals and specialists, such as the child's primary care physician, additional audiology appointments, a speech-language pathologist, an early intervention provider, a teacher of the deaf, a geneticist, an otolaryngologist or ear, nose, throat doctor, and a parent advocate or local hands and voices chapter for further support. This recommendation section should be comprehensive and understandable to both parents and other professionals. Parents should also be encouraged to ask for any further clarification regarding their child's evaluation. For example, parents may want to ask, how much hearing loss does my child have? What do the terms conductive, mixed, sensorineural, etc. mean? Does my child need hearing aids? A cochlear implant? What will my child hear with hearing aids? When should I begin early intervention? Will somebody be able to help me learn about the different types of communication options? Is there a parent support group in my area? Please visit wyomingeddy.org for a full list of relevant questions to ask your pediatric audiologist.
For a family and for an early interventionist to understand a child's hearing loss, they have to have a report that tells what was done, what those tests mean, and then beyond that, what are that audiologist's recommendations for that child. And from an early interventionist standpoint, if you know the recommendations directly from the audiologist, you're able to support that family through the process and make sure they follow through with the recommendations and help them really understand their child's hearing loss. In Wyoming, after a child's diagnosed with a hearing loss, of course the parents of that child are going to meet a variety of professionals, and all those professionals there are there to support that child and support that family through the process of early identification, early amplification, early intervention. And it can feel very overwhelming to a family because there are so many people and lots of advice that's been being given. But what I want parents to know, what is very important for parents to know, is that all those professionals are there to support them. And the support is there in Wyoming for children who have hearing loss and their families. Everything that you need is here in Wyoming.
I would definitely say the information they got from the initial evaluation day is definitely helpful. It was very comprehensive.
Nancy even drew us a picture. She drew us a little diagram of his cochlea and his ear, and that really helped me. And so, yeah.
And most of the professionals that we deal with still use that information from that day up to this point.
I think it was a really good starting point. They gave us a really good base that day. Giving us as much information as we could possibly handle the first day was extremely important. The audiologist gave us a notebook that we were to take home, and that notebook is actually still helping us today. It gave us tabs that had resources and contact information and just general information that we could use to take home with us. We still use that notebook, and we put all of our information in it, and we organize all of our stuff that way, and it was really great. We had 2 audiologists there, and one was very technical, and the other woman put it all in more simplistic terms for us to understand.
Kind of broke it down.
Yeah, it was more of a team effort, and it really helped.
Parents may not initially realize how important it is to seek and find a dependable pediatric audiologist. But by obtaining a complete and accurate diagnosis, parents will have the information they need to successfully collaborate with early interventionists and put a plan in place that supports their child's healthy growth and development. Pediatric audiology specialty clinics are offered in both Casper and Laramie approximately 7 to 8 times per year. These pediatric audiological diagnostic clinics provide families with an opportunity to work with a team of professionals who offer a range of services that includes age-appropriate audiological testing, evaluation of a child's speech and language development, and suitable recommendations for ongoing support. And as always, the Wyoming Early Hearing Detection and Intervention Program remains available to answer questions and offer guidance to parents and professionals caring for children with hearing loss.
And it was a turning point for everything in our lives right now. Our lives wouldn't be the way they are right now if it wasn't for that day. The day we were taken into the evaluation and we got the results was, I guess, our turning point. It made everything possible that we've done today, including him getting cochlear implants. It really made it obvious to us that we needed to do something about it. We got the diagnosis and we said, okay, what from this point, what's next? And we went from there.
Because language acquisition begins at birth, a child's early years provide a window of opportunity during which the foundation for future speech and language skills are formed. Therefore, the first 3 years in a child's life are essential to healthy auditory brain development and future academic success. So when a young child fails his or her hearing screens, it is vital to obtain a complete evaluation of that child's hearing. By doing so, that child may be afforded the opportunity to develop to his or her fullest potential. Parents are encouraged to contact their child's primary care physician or the Wyoming EDDI program for help in scheduling an age-appropriate pediatric hearing evaluation appointment when it is needed for their child. Minimizing or eliminating the delaying effects of hearing loss for a young child does not happen overnight. However, securing an accurate hearing evaluation is the critical first step. By simply establishing a place to start, families and specialists can work hand in hand to see to it that every child in Wyoming begins with a firm foothold on the path to great potential.